Well, good afternoon, Lake Charles and Southwest Louisiana. This is Mayor Nick Hunter, and today is Wednesday, April 1st, and I am truly honored to have someone join me who I think is going to really shed some great light on what's going on right now in Calcasieu Parish. Here on the evening news on a national level from individuals who perhaps are not from Calcasieu or thousands of miles away, and sometimes it just means a little bit more to hear from someone within your community who is a neighbor and a friend on a daily basis, even not during times of crisis, but someone who knows this community better than someone in Washington, D.C. And I think we have that person with us today. Dr. Jordan, would you mind just introducing yourself, maybe a little bit about your background and a little bit about your position with Lake Charles Memorial?
Well, thank you, Mayor, for this opportunity, and I really appreciate all of you've done over the last several weeks. So it's an honor to be here, and I'm certainly glad to participate in this. But I'm Manley Jordan. I'm the Chief Medical Officer for Lake Charles Memorial Health System. I grew up in Northeast Louisiana. My dad was a farmer, and my mother was an educator. And I got most of my, all of my education in North Louisiana. I went to college in the Northeast, which is now ULM, and then did all my medical training in Shreveport. And after I got out of my pulmonary critical care fellowship, I left the state for a period, but found my way home. When you marry a Louisiana girl, you're not going to stay out of the state very long. So we found our way back home in 2004, and I joined practice with some good friends of mine that I trained with in Shreveport, Dr. Robert Craig Broussard, Dr. Kohler, and Dr. Ben Thompson. So I've been in the community since 2004, practicing pulmonary critical care medicine for 27 years, and again, since 2004 here in Southwest Louisiana. And then about 4.5 years ago, I was asked to join the administrative team as Chief Medical Officer here at Memorial. So it's been a pleasure, and I appreciate being here today.
Thank you, Dr. Jordan. Dr. Jordan, I'm just going to confirm now, you have no political agenda. There's no political axe to grind here with this conversation. Is that a fair statement?
That is more than fair, Mayor, absolutely.
All right, so I'm talking to an individual whose primary concern is the health and safety of Southwest Louisiana citizens. Another fair statement?
Yes, sir. I think all doctors, all nurses, even yourself, that's our main goal is to keep people well and safe and healthy.
Amen. Thank you, Doc. Appreciate that. So, Dr. Jordan, what would you say to someone who lives in Calcasieu Parish and who thinks that coronavirus is perhaps not that serious of a situation for us, and what's happening in other parts of the country, New Orleans, or New York City, that could never happen here in Lake Charles or Southwest Louisiana? What would you say to that person?
Well, I think we're learning a lot about SARS-CoV-2, which is the actual virus, and COVID-19, the disease. We are learning a lot in a very short period of time. That virus just was discovered in mainland China in December of 2019, and in 1 month, it spread throughout the entire country of China. And then it showed up on the United States doorstep in early January of 2020. The thing that I think most of us are concerned about is you've heard the word novel. And it's a new virus, which means the genetic material is new. And because of that, we don't have any immunity to it. Our bodies have never seen that virus. So our bodies tend to react a lot worse when we don't have any immunity to either a bacteria or virus. The second thing is that we understand that it's very infectious. It's more infectious than influenza, and we'll talk a little bit maybe about influenza later, but we are finding out it is easily shared between patients. And the other thing we're finding out about is a lot of people don't have any symptoms, or they have minimal symptoms. We use the word asymptomatic. So that's the other disturbing thing, is that people are able to spread this virus in the absence of being sick or having any symptoms themselves. And I think lastly, Mayor, is that this virus has a spectrum of disease. People can be asymptomatic or without symptoms, but also it's causing quite a bit of death, as being reported on the national news. So I think those main reasons is why we need to take this serious. So I hope does that help you understand why the medical community is worried about this?
It does, and I'll actually mention or remind everyone something Dr. Ben Thompson said, I think last night on the news, where he said, though we are not there today, we should not believe that we could not, if we don't take the right precautions, we could not get to a situation where our local medical community would be overrun. And so just comment on that for a minute for those who see things going on in New York City or New Orleans and feel like that is far removed and could never happen here. Would you want to say anything to that individual who thinks that could never happen here?
You know, I think that would be a mistake to make, to think that we're invulnerable to this getting worse rather than better. And I think that certainly there are some reasons to think that we are not New York City and we're not New Orleans. I think there's some perfect storm scenarios that are happening, but I think we can certainly get ourselves in a crisis if we don't do things today and in the weeks ahead. But absolutely, I think, again, like I've told you before, we have an opportunity in front of us the next several weeks to where we can change this trajectory. We can change the outcomes. We can actually, and save lives. That's really what the message is, that each and every one of us, if we can do these things, social distancing, cough etiquette, hand hygiene, and cleaning the common touch surfaces, we're going to save lives. And you've heard me say this, the life is going to be somebody's mother or father, grandparent, brother, sister, could even be your own. So again, this is the most important member of the team is the citizens of our 5-parish area.
Absolutely. I want us to keep social distancing on our minds. I think we'll come back to that in a moment. Let me also ask something that we have heard on occasion. Dr. Jordan, what would you say to someone who says coronavirus is not worse than the flu? We see more deaths from the flu every year than we see from coronavirus. What would you say to that?
Well, certainly both are viruses, and the flu is actually caused by multiple viral strains, and we know that COVID-19 is a single virus. But the only common denominator between the two is that we know how they're both spread, and it's primary respiratory droplet. And we can talk about that and why social distancing does work. The other way is contact. But really, that's the only common denominators, is that they're both transmitted or spread through respiratory droplet. We know the flu has a very short incubation time of about 1 to 4 days. And the incubation time is from the time you get the virus and then start developing symptoms. Again, we're learning an awful lot about SARS-CoV-2 and COVID-19, but we think the incubation time can be anywhere from 2 days to 14 days. The other thing, we do know that COVID-19, or the virus that causes COVID-19, is much more infectious. There's a reproductive number that epidemiologists refer to, and COVID-19 is about twice likely to be transmitted as the flu. I think the other difference is that the flu has a very classic abrupt onset. You know, all of us have been talked about how flu starts with fever, cough, body aches, and fatigue. The symptoms with COVID are much more variable, and also they're much more insidious. The symptoms can occur over 5 days to a week. So, and again, the symptoms can vary from being no symptoms to being very minimally symptomatic with a runny nose, sore throat, cough, and it can also progress to respiratory failure, which we certainly are battling today right now in our ICUs throughout Southwest Louisiana. So the symptoms are variable, much more so with COVID-19. Mortality is a lot higher with COVID-19. I don't think we've got the final numbers yet. We probably won't know the absolute case fatality rate for another year. But we do know that flu overall mortality year in, year out is about 0.1%, which is about 1 in 1,000. But we think COVID-19 right now, it's in certain areas, it's above 3%. But probably before it's all said and done, it's going to be somewhere right around 1%, maybe a little bit less. Hospitalization rates are a lot higher with COVID-19. only about 1 or 2% of people with flu get hospitalized, but with COVID-19, upwards 15 to 20% require hospitalization. And also the high-risk population is a little bit different with flu. Flu, we know the very young and the very old, but we know COVID tends to affect people more so with immunocompromised states, almost regardless of age. We're seeing a lot of disease in younger people, something that China's experience didn't show us, but we're starting to see some 30 and 40-year-olds be affected by this more so than we thought than the experience in China.
Great insight, Dr. Jordan. I tell you, one thing you just said really hit home for me. You said that the hospitalization rate for the flu is about 1%.
1 to 2% on average year in, year out.
And then for COVID-19, that figure is closer to 15%?
Yes, sir.
That's pretty significant. So if you can imagine, that much rush on a healthcare system, it's pretty extreme. And then trying to deal with all the other day-to-day things that happen that are completely non-flu or non-COVID related.
You know, Mayor, when we started talking about this locally, I can remember 4 weeks ago, we were starting to have meetings in the hospital, and we got a lot of things right. But the thing that we didn't know then was that the virus is already in the community. It was already here, being spread, and we didn't realize that. We thought it was still out in Washington, California. It started to show up in Florida. But 4 weeks ago, the virus was here. We didn't fully appreciate it. That's why where we are today, social distancing, and we're in a mitigation phase. You'll hear our Surgeon General has been on TV talking about mitigation strategies. And that's all about protecting the high-risk population and also conserving our healthcare workers' resources. We got to conserve the healthcare delivery system and also the health and well-being of doctors, nurses, lab techs, respiratory therapists, x-ray techs. We've got to protect their health.
Absolutely. And God bless those individuals for what they're doing throughout the year, every day of the year, but especially right now. Dr. Jordan, you spoke a moment ago about the hospital community having meetings. I think it's so important that when we're going through something like this, agencies are not working in silos, that we are sharing knowledge and information. Talk just a little bit about that communication that happens between the medical community, perhaps between different hospitals in a situation like this, and then talk a little bit about the medical community's communication with local government.
You know, I'm going to steal one of your phrases in a word that you've used, which really struck an accord with me, or it resonated with me, and that's synergism. I think it depicts it 100% that there has been synergism between the healthcare delivery systems, between Memorial, St. Patrick, West Cal, and Avail. We talk almost on a daily basis, sometimes several times a day, about how their capacity is holding up, their admission status, their bed status. So there's a lot of communication going on amongst the hospitals. I also want to comment that SWLA is doing a great job at their testing center serving our citizens on the north side of town. Also, there's communication. I certainly talk to you on a regular basis. I talk to Dr. Cavanaugh with the Office of Public Health. I also talk to our representatives, our legislative delegation. They are wanting to know our challenges, particularly testing turnaround and whatever barriers they can address at the state level. So we're talking to the governmental agencies. And also I'll tell you that the outpouring support from the private industry, we really appreciate the meals, the protective equipment that has been donated. This truly has been a collective, collaborative community effort to benefit our community. It's a silver lining during a dark time, but certainly there's light at the end of the tunnel that we're getting closer and closer to.
Amen. Amen. Thank you, Dr. Jordan. And I want to reinforce what you said a moment ago, that when local government decides to take steps, or even sometimes not to take certain steps, those decisions have always been made with the local medical community at the table. And in a situation like this, we always value the input from the medical community, but this is a medical and health crisis. So, of course, we would want to lean heavily on the input from the medical community.
Well, we really appreciate having more than a seat at the table. You've really included us every step of the way, and not just Memorial, but Christus Ochsner and West Cal and Avail. You've allowed us to have a lot of input in the decision making, and certainly we hope we've given you some insight that's been helpful. Again, there's a lot of things we don't know, and we're learning things every day. But again, I'll tell all the governmental agencies that we appreciate having y'all's ear. It really helps.
I tell you how much I appreciate you guys being there, because these decisions that we're making, they're tough decisions, and we've got to have the medical community there to help us make them. So we spoke a moment ago about light at the end of the tunnel. Dr. Jordan, what are some things, and we've heard these ad nauseum, but I think we've got to take every opportunity to remind the public the best ways to prevent the spread of COVID-19 throughout our community. And let's specifically focus for a moment on social distancing.
Absolutely. And I'll tell you, the culture in Southwest Louisiana, we are very social people. We love sharing time and experiences and making memories with each other. And we're going to do more of that in the future. But right now, this what the community can do. Our citizens can understand why we're asking them to do something. It's very important. What we're trying to get people to do is social distancing, and that's making sure that you maintain that 6-foot bubble. I call it 6-foot protective bubble between you and the next person, and practicing that best you can. We know people have to go to the grocery store and go to the pharmacy. But even when you're doing that, you're not being rude, asking somebody to make, just trying to put distance between yourself. Hand hygiene, we can't talk enough about that as well. The hardest thing I think to do is not touch our face, our mouth, our nose, our eyes. Even if you had the virus on your hands, you will not get infected unless you touch your face. So these, and the common touch surfaces probably not as easily transmitted through touch surfaces, but still it does happen. It depends on what the viral load is. And we're learning a lot every day how long the virus can live on certain substances. But sanitizing common touch surfaces is so important as well. This is important because, again, these it sounds simple in theory. It's hard to practice routinely, but these simple things are going to change the outcome for our community. And again, past experiences, we've been through hurricanes. We've been through 2009. We went through the H1N1 pandemic, and this community always pulls together and does what's required of it. And that's why I've been on other interviews, and I'm optimistic. And I'm optimistic because of those past behaviors. I think those past behaviors define the resilience of people in Southwest Louisiana, and I firmly believe soon we're going to get back to a normal way of life. I wish I could tell you that's going to be 6 weeks, 4 weeks, how many days, but I'm not going to make up a story just to have an answer. I don't know.
Sure. But certainly you would agree, the next 2 to 3 weeks are critical for Lake Charles. I mean, we're having this conversation on April 1st. We're hearing it on a national level that the next 2 to 3 weeks are critical.
Yes, sir. And this is the time, if you want to do something, this is the time to do it and practice social distancing and these other hygiene measures we just talked about. And this is the time to do it. If you've not believed in this, now's the time to get some religion about it.
Yeah, amen. And again, I don't think we can reinforce enough. You said it from a medical perspective. I want to reaffirm that the vast majority of local elected officials, we support what the governor has included in his executive orders. And, if people just use a little common sense about what is a necessity to get out of the house and to go be around other people, unless it's an absolute necessity, we are asking right now, stay home. Stay home, unless it's an absolute necessity, and that's a difficult thing for people, but stay home.
Well, we're making some tough choices in healthcare. Our surgeons and other physicians do procedures. We've been pretty much mandated by the governor to postpone surgeries or other procedures that could safely wait for 30 days. And I think that same advice could be given to our public. If you don't need to make that trip to the grocery store, can you wait 2 or 3 days a week? I mean, so I think that same advice should be given to everybody. If you can postpone a trip, by all means do it.
And what another thing we're seeing right now is we have such big hearts here in Calcasieu Parish in Southwest Louisiana. A lot of people are sitting at home and they just want to do something and they want to have a tangible example of how they're helping. And I think you would agree the biggest thing people can do right now to help is truly to stay at home. And, we can pour out prayers and love upon this community right now, in essence, by staying home. And that's, I think, the biggest message that we want to give to people. Dr. Jordan, you mentioned a second ago the resilience of Southwest Louisiana. Thank you. I agree with you. We've been through some tough things in the past. You mentioned optimism. I'm optimistic too. Just talk a little bit more about that. Your optimism in the medical community, the national medical community, and through this on a local level.
I think the phrase, when the going gets tough, the tough get going, and that's what we're seeing in the medical community, not just locally, but nationally. And I do think everybody in healthcare, we go into it because we want to make a difference in our communities. And I don't care what you do in the hospital, whether, you're a food worker or whatever you do in the hospital, you go into healthcare, and same thing for, I think, government service. You're trying to make a difference in your community. And you're by nature an optimist. So I think we remain optimistic despite these challenging times. And particularly, we have to be optimistic. And I don't think it's a Pollyanna optimism. I do think we all know that this is going to come to an end. And we just got to get through it the best we can. And again, the best we can is slowing the spread of the virus. And that's, we're not going to get technical about flattening the curve, but this is all about slowing the spread of the virus to where our healthcare delivery system survives intact. But no, Nick, I'm very optimistic because I do know the hearts of people in Southwest Louisiana. They've allowed me, a lot of my patients have allowed me the privilege of trusting me, and I've seen their hearts. So that's where my optimism comes from.
Absolutely. Before we close, I just want to also say that there are so many other agencies doing some good work right now. You mentioned a few of them, but Christus Ochsner, Avail, West Calcasieu Cameron Hospital, Southwest Louisiana Center for Health Services, a lot of private agencies are just working together feverishly to make sure that we're taking care of our citizens here in Southwest Louisiana. So even though today we have a representative from Memorial, I don't want that to be lost on people, that this is a community effort. And I just want to say thank you to everyone in the medical community right now for the hard work you're doing. And if you are not in the medical community, again, if you want to help those individuals, we'll stay home. And we're doing a lot by just staying home. So ladies and gentlemen, I think you heard it from the horse's mouth. There's no political agenda, and a gentleman who's got some education and background that I certainly trust in a time like this to give us the straight story. Dr. Jordan, thank you for participating in this call today.
Mayor, thank you very much, and God bless Southwest Louisiana.
All right, you too, and the same to Nancy and the family.
Thank you so much.
All right.